A very good evening to all of you in this live interactive session of ours where we generally try to discuss quality Ayurveda with you. And today I am live with you from UK. It is the UK visit which was much awaited by all of you. And by the grace of Almighty, once again I am there in UK and once again I'm talking Ayurveda with you. So today's live, which we are currently doing for you, is from UK. And as I always say, your questions are our priority. Now, talking about autism, what I see in today's modern and developed world is that autism is really becoming such a common disease nowadays. And when I talk about autism, it's not a case that uh, everyone who's being diagnosed with autism is actually autistic. Unluckily, there are so many kids who are a case of a bit of language delay, who are a case of a bit of intellectual disability. Most of them are nowadays being categorized wrongly as autism. When we talk about autism, I always say autism is not a disease but a temporary phase in the life of a child if treated timely. Now, that if is really very important when we are talking about autism. And why that if is really important is that unluckily, when a child is the parents notice that there is something which is different in their child as compared to other children. The biggest problem over there is that despite knowing that, first of all, the parents are not ready to accept themselves. It is understandable that it's not easy for anyone to accept that yes, their child is autistic. It's not easy. Everyone wants the children to be healthy. Everyone wants the children to be exactly normal. So being categorized as an autistic child is not always so easy for a parent to accept as a parent. So that's why in the beginning phase, when a child is not making good eye contact, when a child is not responding to the name, when a child is not speaking words and is using sign language or gestures to correspond with others, the parents, despite having the fear that their child is different from others, and despite somewhere knowing that yes, these may be signs of autism, they always want the child not to be diagnosed as autistic child. As a result of that, they keep on delaying consulting, and even if they consult a doctor, after all, the doctor, because majority of the doctors, they feel that autism is something, a condition which cannot be reversed. And if a child is suffering from autism, he will suffer from autism throughout his life. So that's why even if the parent, by all means, they take their kids to a doctor, even if a doctor does diagnose the child as being autistic, the child is simply left to the mercy of the therapy centers, which start doing a lot of ABA work for them, which start doing a lot of, you'll say, speech therapy work with them. But unluckily, majority of these therapies, they are insufficient to bring a child out of autism. These may be supportive, these may provide a bit of life skills to the child. But if we really want a child to come out of autism, which is absolutely possible if the right kind of approach is followed for the child in the right way. So, if the right approach is followed, there is no reason why a child cannot come out of autism. So, to manage a child coming out of autism, it is very important to understand what exactly autism is. When we talk about autism, in majority of the parents, when the parents they approach me, I always tell the parents that see, autism is not a disease of the brain. Autism is not going to benefit by using memory tonics. Autism instead is a disease of mind. We need to understand that we are having a conscious mind and a subconscious mind. So when we talk about the mind, when we talk about the conscious mind, when we talk about the subconscious mind, if the subconscious mind, which is like a library where everything is being stored through the conscious mind, The conscious mind is the mind which is the active mind, the mind which is the interacting mind with the outside environment. Our eyes are looking at things, our ears are listening to things, our nose is smelling things, our skin is feeling things. All those senses, when they are taking certain signals inside, when they are taking messages inside to process those things, it is the work of the conscious mind. So, generally, the conscious mind will keep on gathering information and it will keep on depositing that information for the subconscious mind. And the subconscious mind is like a library. It will keep on storing that information. It will keep on having that information inside it. And as and when required, it will provide that information for the conscious mind to interact, for the body to respond. So if you're asking a child a question, and if the child is replying to the question perfectly, now that needs a very good coordination of the conscious and the subconscious. There are certain activities which are carried on from conscious towards subconscious. For example, you ask a question, so are you hungry? The reply has to be involving the subconscious, because what exactly is hunger is something which a subconscious can tell. A conscious mind won't be able to answer that. So, although it is a very technical kind of thing beyond words to explain you, but what is very much understandable, which is very important to understand over here is that we need to bridge up the information processing between the conscious and the subconscious in children if we really want a child to come out of autism. And before we do that, we need to ensure that the mind is working at a nice ratio. In many cases, the subconscious mind is working to a lesser percentage than what is required. As a result of that, due to the overactivity of the conscious, the child will keep on hovering around here and there, and the concentration span of the child will be too less. As a result of that, when the concentration span is less for the child, whatever might be the kind of therapies that we are doing for the child, if a child is not concentrating, if a child is not getting himself or herself involved for those activities, you cannot expect a child to be replying you in a proper way. So that is why when the children they come to us, we prefer working on the conscious subconscious coordination, and we prefer working much more on the subconscious. So, before I go further into the details of this, I would like to acknowledge your question. We are having Surya English Tutorial Home ID. Trishita, you have shared the patient code is fine now, but she understands everything but could not ask any question. So, please, in case of Trishita, the best thing is that she has started understanding now. And as we carry on with the ABA more consistently, you will see that you will start getting responses from her also. Please be very regular with your ABA sessions. That is something which is really very important. At times we give herbs, the herbs they work, but we are not doing the ABA sessions that consistently. Now that may cause problem for the child, because if we really want a child to be conversing in a proper way, ABA sessions are something which should not at all be missed. So that is something which is really very important. So if you can elaborate me further on who is doing the ABA sessions for you, and what is the frequency of those ABA sessions, I can even give you further insights into it. And then Rabindra Kumarji, you have shared, so my daughter Miss Nancy Gupta, age 6.5 years, in a treatment under use since 11/4/2024 at Chandigarh. Having this, her coordinator is Sukhraj and her ABA psychologist is Gunjan. Rabindra ji, that's really great to know. But currently, since Gunjan is not working with us, so have you been allocated a different psychologist, or are you missing out on the sessions in her case? I would request you, please do not miss out on her ABA sessions. They are really very important for her. So do remember ABA. Now, ABA, which is also known as Applied Behavior Analysis, that really is very important for every child. See, all of us are different from each other. The methodology in getting a work done from me may be different from the methodology in getting a work done from you, which may be different from the methodology in getting a work done from your friend. So every one of us is different from each other. And similarly, our mind, our behavior, our thought patterns, they are all different from each other. God the Almighty has made us like that. Now, what is very important over here to understand is that since we all are different from each other, if we really want to get work done from any one of us, the methodology is going to be different. And to understand that method, we need to analyze the behavior. So, in adults like us, it's easy to analyze the behavior, but in children, and especially who are suffering from autism, ADHD, and other learning disabilities, it's really very tough for anyone to understand the behavior of the child. So that is why ABA is very important, where the psychologist, an expert, ABA expert, will be analyzing everything, every part of the behavior of your child. And once that behavior has been thoroughly analyzed, then they start working towards modifying that behavior. And while that is being done, the herbs which we are giving are there in full support for the child. They are working very nicely for the child to enhance the positivity, to ensure that yes, the child is at a mindset where he is working in tandem with us to help us modify that behavior which he or she is currently having. So that's why whenever I meet any one of you, whenever I connect with any one of you, I always tell you that please, while you are taking our herbs, please do not miss out on any of your ABA sessions. They are equally important, rather, even more important in kids where age is more as compared to the normal herbs which are being given. So, I was talking about increasing the working of the subconscious mind. So, when we work with certain herbs, certain combinations, one of them is Brain-OR. Now, when we talk about Brain-OR, it is in the form of syrups, it is in the form of capsules, it is in the form of granules, any kind of Brain-OR. I would firstly go for the Brain-OR syrup form for you. When we talk about the Brain-OR syrup, as you will be able to see, I'm trying if my team can detail it for you. Yeah, you can see it on your screens now. Now, this is a setup which contains a combination of herbs which work on the subconscious mind to enhance the concentration of your child, to reduce the hyperactivity of your child, to increase the work focus of your child. But all this is happening without causing any kind of slightest kind of sedation for your child, because we want something for our children which is very safe, which gives results, but is not at all troubling. So, Breno syrup is the one which is suitable for you if you are visiting me in OPDs. In case you are not able to visit during OPDs, then we are having it in granules form, which comes into various varieties like Brain-OR mild. Now, Brain-OR mild specifically is for a child where the child is not having too much of hyperactivity, but yes, we cannot say that the child is hypoactive also. So, where the child is not too hyperactive and we really need to focus on the speech of a child, then Brain-OR mild hot sip is the one which we use. And when we talk about someone who is really too hyperactive, then it is Breno DS. Now, Breno DS is a syrup which you can always try in any of your children where you feel that the child is too hyperactive, the child is, you can say, has started kicking, hitting also. There also it really works nice. If the child is having any sleep disturbances, there also it works very nice. It gives a marked improvement in hyperactivity, and that too with real quickness. And when any of these things is being done, as I just mentioned you, we always keep this thing in mind that these combinations are to be given to kids. As a result of that, when we are making any of our supplements, we take utmost care that they should be with zero side effects, because life is precious. And if we are giving anything for the improvement of your children, we always ensure that no slightest harm is cost due to any of these things. So coming to you, Rivendraji, you have shared that she has taken about 25 ABA sessions till now, and hyperactivity is improved by 60%. And outside home, yes, she can show some hyperactivity, and park, playground, temple, etc. Attention is also improved. Ravindraji, that is really very great to know that she is improving, and you will see her improving further. And please do remember that you need to connect with your team, the backend team, so that they can allocate a new psychologist to you in place of Gunjan, because psychotherapy is something which should not have any kind of break if we really want improvement in the child. So that is something which is really very important. So for all of you who were waiting for me to be over here in UK, I would like to tell you that right now I am over here, and my today's live, the brief interaction which I had with you was because I really wanted that my commitment to you, that wherever I am, whenever time allows me, I will definitely join with you on live sessions on Wednesdays. So that was a part of my commitment, that yes, I have to be live on Wednesdays, because I very well understand that as parents, when you are giving your children, for the life of your child in our hands, we need to be up to the task. We need to be very sure that we are giving it our level best. And we need to keep our promises. And one of those promises is staying connected with you through live sessions on Wednesdays. And that is something which I always try. And Karen Kelly Simonsi, my son has shown a lot of improvement as well. That's really very great to know. Varun Gupta ji, you have written that my son Mivan Gupta is 3.6 years and have delayed milestones. Varanji, share some videos of your child with us to the helpline number which is there on your screen, and our team will analyze, and we definitely will be guiding you in that regards. We need to be understanding and knowing which are the major milestones that are getting delayed. Whether there are a lot of things when we talk about milestones, the psychological milestones are different ones, the bodily milestones are different ones. So share some videos with us. And Ravindraji, as I just mentioned, I appreciate you sharing all the concerns with me. I would really appreciate if you can get back to the team and ensure that the psychotherapy sessions are not missed, so that a new psychologist is allocated to you to ensure that the sessions are going on in the nice way. So, once again, before I take a break from you from today's live, and before I say bye to you, I would like to mention, as I always mention, that autism is a temporary phase in the life of a child if treated timely. So, if you feel that yes, my child is having any kind of signs which are resembling autism, which are touching autism, don't hesitate. You are having our numbers, share the details so that the team can get back to you and can guide you in the best possible way. So, for all of you who joined us today, once again, I would like to thank you for joining us. For those who couldn't join from India because of the timing difference, which was a bit odd for them today, you can share your questions on after this live stream of mine so that the team can get in touch with you. So, with these words of mine, I would like to take a break from you from today's live session. Thanks for joining us today. Have a good day.